Good morning, everyone. Today we have a video on another topic that is related to the peripheral parasympathetic ganglion. This is another peripheral parasympathetic ganglion, that is the submandibular ganglion. Submandibular ganglion. Now, we have already discussed the basic concept of ganglion in our previous video. For those who have not gone through it, I can just repeat it quickly that ganglion is a collection of neurons that is present outside the central nervous system. That means outside the brain and spinal cord. We call it as peripheral parasympathetic because we have few ganglia close to the spinal cord, which we call them as sympathetic, and these ones are present close to the organs which they supply, so we call them as peripheral parasympathetic. Okay, now we discussed that first we have to cover the ganglion under these three headings: location, roots, branches. Coming to the location, the submandibular ganglion is present on the hyoglossus muscle. It is present on the hyoglossus muscle, so you have to remember this muscle name. It is there on the hyoglossus muscle. Now, regarding these ganglia now, we have to learn two things. One is where is it, to which nerve it is related to according to its location, and another is to which nerve it is related functionally. Now, if we talk according to the location, we call it as topographically related to. So this ganglion is topographically related to the lingual nerve. As you know that lingual nerve is going towards the tongue, it will supply the tongue. So it suspends this ganglion by its two roots, posterior root and the anterior root. So we say that topographically, that means according to its location, it is related to the lingual nerve. Now talking about the functional relation, functionally related to. Now what does this mean? This means that parasympathetic root is carried by which nerve? Because whenever we are talking about the glands, the submandibular ganglion is going to supply submandibular gland and sublingual gland, whose secretions add to the saliva. So the parasympathetic component is secretomotor. That means it will stimulate the gland to produce secretions. So therefore, the functional component means that functionally it is related to that nerve which will be carrying its parasympathetic preganglionic root. In this case, it is the cauda tympani branch of facial nerve. All of you know that cauda tympani nerve is a branch of facial nerve. So we have to learn these two things, that topographically, according to its location, it is related to the lingual nerve from which it is suspended by two roots, and functionally it is related to that nerve which will be carrying its preganglionic parasympathetic fibers, and that nerve is the cauda tympani branch of the facial nerve. Moving ahead, we have branches as already discussed. It will be supplying to submandibular gland and sublingual gland. Then coming to the roots. Like in the previous video, every ganglion has three roots: parasympathetic, sympathetic and sensory. Parasympathetic, I already told you, is secretomotor. Whenever any ganglion will be supplying a gland which has to produce its secretions, the parasympathetic component will be secretomotor. It will stimulate the gland to produce secretions. And regarding the sympathetic one, I already discussed, this will travel along the blood vessels and it will supply the blood vessels of the area, that means of these glands. Then we have the sensory. The sensory one is the lingual nerve. So all the sensations from the submandibular and the sublingual gland will be carried by the lingual nerve, which is a branch of mandibular nerve. It will be very easy. You don't need to worry when we'll draw it in a diagram. And as I always say, you should draw this diagram along with me. I'll be quite slow. You can easily draw it with me, and that will help you to learn it. So we can start it with tongue. This is the tongue. Below the tongue, there is a gland. You can give this outline to the gland. This is the sublingual gland. Sublingual gland. And here we can draw the submandibular ganglion. I told you that this is there on the hyoglossus, and it is also superficial to the deep part of submandibular gland. So this is the submandibular gland. This gland has two parts, superficial and deep. This ganglion is there on the hyoglossus muscle, superficial to the deep part of submandibular gland. So this is the submandibular ganglion, the main topic of discussion today. Now we'll be drawing, so it will be supplying this gland and it will be supplying this gland, but how? How do the branches reach these glands? So starting with the parasympathetic root, first of all, we'll be drawing the entire diagram with the black color so that we can show the different roots with different colors. That will make it easy to understand. So now we'll begin from the pons. We'll begin from pons. This is the outline of pons. I think it is very easy to draw. And then you have the medulla with the broader part and the tubular part. So you can just make an easy outline of the pons and medulla. From the pons, there starts the facial nerve. Now, from pons you have fifth nerve, you have the facial nerve also, that is the seventh cranial nerve. Now the seventh cranial nerve has a motor root and a sensory root. Starting from the, so this is the motor root of the facial nerve and this is the sensory root of the facial nerve. This is the sensory root. This is the motor root. So this sensory root is given the name nervus intermedius, and this becomes the facial nerve trunk. We'll be discussing facial nerve in another video. For the time being, you should be aware that when the facial nerve runs, it takes bends. So this becomes the first bend and this becomes the second bend, after which it has a vertical course. And in its vertical course, it gives a branch, that is the cauda tympani branch. So this is the cauda tympani branch. I repeat this thing. This is a facial nerve, motor root, sensory root, both joined to form the main trunk. The first genuine, then another bend, then the vertical part, and this is the cauda tympani nerve. Now this cauda tympani nerve is acutely joined by the lingual nerve. It is joined by the lingual nerve. So you have the fifth cranial nerve. All of you know its branches. We have one branch of thalamic going towards the eyeball, maxilla, maxillary nerve, and then the mandibular nerve. Now this mandibular nerve, it gives a branch, that is the lingual nerve. So this is the lingual nerve. I told you cauda tympani is joined by this lingual nerve Now these fibers run together, and this lingual nerve now suspends the submandibular ganglion by its two roots and then proceeds towards the tongue. We already discussed this, that submandibular ganglion is topographically related to lingual nerve. That means it is suspended by two roots with the lingual nerve. One is the posterior root and this one towards anteriorly it is the anterior root. So posterior root and anterior root of lingual nerve suspend the submandibular ganglion. Right? Now what we have done, facial nerve giving a branch chorda tympani. Then we have the fifth nerve through which mandibular nerve arises, which gives a branch lingual nerve. Both of them join to form, they run together and suspend the submandibular ganglion by its two roots and then further move towards tongue. Now, we have mainly to discuss the parasympathetic component here. The parasympathetic component will start from a nucleus present in the pons. This nucleus is superior salivatory nucleus because this is related to the secretion of saliva. So we have the superior salivatory nucleus. Like in ciliary ganglion, we had Edinger-Westphal nucleus. Now again we'll use the same terminology, the Edinger-Westphal, the preganglionic parasympathetic fibers. The preganglionic parasympathetic fibers will start from the superior salivatory nucleus, will run through the nervus intermedius, that is the sensory root of the facial nerve, then run through the main trunk of the facial nerve, and then go through the chorda tympani branch, right? Then enter the submandibular ganglion through its posterior root, through the posterior root of the lingual nerve and relay here. This is how we show the synapse and supply the submandibular gland. Now what about the sublingual gland? Again, the fibers after this relay, they will be known as postganglionic because the relay has occurred in the ganglion. They will leave the ganglion through the anterior root and they will be reaching the sublingual gland. So this is how parasympathetic or parasympathetic secretomotor component, which is going to stimulate these glands to produce secretions, reaches these glands. I'll repeat it quickly. We have the preganglionic parasympathetic secretomotor fibers starting from the superior salivatory nucleus in pons. They follow the nervus intermedius, go along the facial nerve trunk, chorda tympani branch. Chorda tympani is joined by the lingual nerve. Then they enter the ganglion through the posterior root, relay in the ganglion. Postganglionic fibers will start from here. They will supply the submandibular gland. And now what about the sublingual gland? They will again leave the ganglion through the anterior root, join the lingual nerve and now go and supply the sublingual gland. This is about the parasympathetic route. Now coming to the sympathetic route. Sympathetic route, as usual, we did it in the previous class also. It will be starting from the spinal cord. So again, quickly we can draw a transverse section of spinal cord. So this is the ventral grey horn, dorsal grey horn, the spinal cord, the central canal of the spinal cord, and here we have the lateral grey column, which is present in few segments. So this we are talking about the T1 segment of spinal cord. This is the dorsal root, the dorsal root ganglia. We have the ventral root, both of them join to form one spinal nerve. Then the dorsal ramus, which will go to the back, the ventral ramus, and again we have the sympathetic ganglia, that is the, which one? The superior cervical ganglion. So you can label all the structures which you are drawing, so that your diagram is self-explanatory. Now, the sympathetic fibers, remember, they have to travel along the blood vessels. So they will start from the lateral gray horn, run along the ventral root, then the spinal nerve, here the spinal nerve has formed, then its ventral ramus, then enter into the superior cervical ganglion, relay here. Now, which fibers have started? The post-ganglionic fibers. The post-ganglionic fibers will start from this ganglion, travel along a blood vessel. Now, which blood vessel will be there? Here you have the, close to the submandibular gland, you have the facial artery. You can label it as the facial artery. So, the fibers will form a plexus around it. Now they will enter into the ganglion, but they won't relay because the relay has occurred here. They will, without relay, they will pass to the submandibular gland. And again, without relay, they will pass to the sublingual gland. So this is a very easy diagram. This is very easy to draw if you just understand that how the fibers are reaching this. Then they again leave the ganglion through the anterior root and go to the sublingual gland. Now talking about the sensory pathway. In the sensory pathway, you will have the sensations from the sublingual gland. We can show it with another color. From the sublingual gland will again enter here. They can directly follow the lingual nerve, or they can come through the ganglion without relay, again leave the ganglion and enter the lingual nerve. From the lingual nerve, then the mandibular nerve, and then the trigeminal nerve, the trigeminal nucleus, and the higher centers, reaching the sensory cortex of the cerebrum. So whenever you have to trace the sensations, I already told you, we have to trace them in opposite direction. Starting from the ganglion, starting from the gland, then the fibers pass without relay through the ganglion. Even they can pass directly through the lingual nerve, and then lingual nerve, mandibular nerve, not this nerve, because the sensory nerve is a lingual nerve. So the lingual nerve is the main sensory component. Lingual nerve, mandibular nerve, fifth nerve nucleus, and then higher centers. Similarly, from the submandibular gland also, the sensations can reach directly from here and then leave the ganglion through the posterior root and go higher up through the lingual nerve. So this is all for today's class. We have finished the submandibular ganglion. In my next class, we'll be discussing the main questions related to the submandibular ganglion. Thank you so much for your patience.